going to perform the assessment of the ears. Of course, the ears vary in shape and size. They should always line up with the eyes, and they should be symmetrical. There should be no swelling, any lesions, or any exudate or anything like that. And inside the ear, there should be very minimum ear wax. There shouldn't be any thickening as well. The mastoid process should be palpated, and I'm palpating the mastoid process for tenderness. And of course, when I touch it, he's not flinching, or giving me any evidence that there's pain. Was there pain when I touched your mastoid process? So he's denying pain. So I would say that part of the exam was okay as well. Then I want to look inside of the ear. When I look inside the ear, I should be looking for his external structures. I should make sure that there's no swelling, no redness. The tympanic membrane or the eardrum should reflect the otoscope's light. It needs to be like a shiny gray color. The light should also reflect the malleus, and sometimes you can see the incus when you look into the ear. Once I change from one ear to the other, it's important to change, of course, the tip of the otoscope, because we don't want to contaminate in case there was a bacterial infection inside of one of the ears. I'll go ahead and use the otoscope to perform the otoscopic exam. And what I will do is, of course, kind of tilt his head slightly to the opposite direction, look into the ear, pulling the pinna of the ear up and back to straighten the ear canal. And I can see his tympanic membrane, and of course it is a transparent gray looking color. There is no redness. I see minimal, very minimal wax into the ear canal on this side. So the internal assessment of the ear is normal as well. Next, we're going to do what's called the Rhine test, and this is going to compare bone and air conduction. I'll strike the tuning fork and hold it against the mastoid process, and the patient I will count the seconds, and he'll tell me. I'll have him to raise his hand when he can no longer hear it.
No.
Okay.
No.
So it was about roughly around 4 seconds for each ear. Next we'll do, of course, the Weber test. And the Weber test, we're going to strike the tuning fork and place it on his forehead, and he should hear the sound of the vibration bilaterally.
No.
Did you hear him in both ears? Yes. Okay. So he did hear the vibration in both ears. And what we learned is that air conduction is generally twice as much as bone conduction. That concludes the assessment of the ear.